Since the announcements last year of COVID-19 vaccines being developed and approved for use in Canada, we have been having conversations about safety, efficacy, and the speed at which development of these new vaccines were done with community members, friends, family, and most importantly, from folks living with HIV or at risk for HIV. Today, I'm joined by Dr. John Gill, the head of the Southern Alberta Clinic for persons who are living with HIV infection, to talk more about vaccines, including COVID-19, and how important a tool they are for the prevention of disease in general and improved health outcomes for all of our communities. So, Dr. Gill, thank you so much for joining us today. I'm going to give you a little bit of an opportunity here to please introduce yourself and give us a sense of who you are and what you do.
Thank you, Mark. My name is John Gill. I'm an infectious disease specialist who trained in virology many, many years ago. I work at the Foothills Hospital when I'm not running the Southern Alberta HIV program. I've been in the field of clinical virology for like 30 years, and I find them fascinating and very difficult adversaries.
Thank you so much for that. So we're going to start with our questions because these are very short trainings that we do. So first question is really, let's start with the most basic question of all, and that is, what is a vaccine and how does it work?
Well, viruses are often covered in proteins, and some of the spike proteins, as we call it, that attach to your cells and allow the virus to get into your cells to cause you illness. A vaccine is something that triggers the body to become responsive or immune to those proteins on the outside of the virus. In other words, it's a molecule that trains the body to recognize viruses that shouldn't be there and attack them. Excellent. So it's a training molecule.
Okay. Oh, train the trainer. So how safe are COVID-19 vaccine for folks in general, and especially for those who are maybe living with HIV?
Well, I was very pleased when these vaccines appeared. I've lived in the HIV area where for 30 years we've been trying to find a vaccine against HIV and have been unsuccessful. So I was a little bit pessimistic. The three types of vaccines that are being developed all look remarkably good and remarkably safe, which is very gratifying. Two of the types of vaccine have been licensed in Canada, and I suspect the third will eventually be licensed.
Excellent. So, to the best of your knowledge, are there any conditions that may prevent access to a vaccine for persons living with HIV?
I've been thinking long and hard about this because it depends on the type of vaccines that we've used in the past. And we've said people who are allergic to eggs shouldn't have the flu vaccine. People with terrible immunity wouldn't really benefit. Now, the two classes of vaccines that are licensed in Canada are really different to anything that most of us have experienced in the past. And the evidence to date is that they will benefit anyone or everyone living with HIV. And the risks that we can worry about seem to be incredibly small in contrast to the risk of any of us contracting COVID-19 infection.
What kind of side effects might someone anticipate or possibly expect to have? I know that side effects are not experienced by everyone in the same way. My own experience with medications are an example of that. So just curious as to what side effects some folks might be or should be prepared for.
Well, these vaccines, all of the three class or types of vaccine are given by an injection into the muscle in the arm. And every time I get an injection in my muscles, it feels sore. It may feel red. The muscle may ache for a day or two. It might be a little bit sore when I roll over at night. So those are called a local reaction to the vaccine. In COVID, the three different types of vaccines that we give, that is quite universal. A mild, just soreness, a bit of tenderness that usually fades away.
Awesome.
In a few people, they may feel a little bit unwell with a mild fever the next day, but these are all minimal symptoms. And in contrast to contracting COVID, are trivial.
Awesome. Okay, thank you for that. So Last question for you. Is there anything that people, particularly living with HIV, that they should be considering or mindful of when considering their COVID-19 vaccine options? I know that there's been talk about, do I wait and choose? Is there one that's better than the other? What would be your best consideration, or what should folks be really thinking about here?
I think in HIV, the considerations are the same as everyone else. The first vaccine that is offered to you, that is a licensed product in Canada, is the best one for you. People do look at the data and want to cherry pick, oh, this looks 5% better on this or 10% better on that. I would hate people to delay thinking, oh, I'll get a slightly better vaccine in 3 months, and in the meantime, pick up COVID and get really sick. All of the vaccines are remarkably good and remarkably safe. And the first one you're offered, sign up for. And that applied for me, it's applied for my family. First one you can get it, because the licensed products in Canada are really good and really safe.
Wow. Thank you so much for joining me today, Dr. Gill. I really appreciate you taking the time out of your very busy schedule to give us some time and answer some of these questions for us. I'm going to let you go, and I hope you will enjoy the rest of your day and the weekend ahead.
Thank you, Mark. Delightful to talk to you again. Bye-bye.
Thank you. Bye-bye.